Welcome to Think Like a Nurse 2. This is our third lecture, which is going to be talking about the urinary and renal system. I do need to talk a little bit more from our previous lecture. There were a couple of other medications that I wanted to add in, and one is called Monurol, and the other is called Macrodantin. The Monurol is a one-dose beverage drink. It's actually an antibiotic that can be mixed as a beverage to treat just a simple UTI. The other is Macrodantin or Macrobid, which is Macrobid. It's the brand name. And this medication is usually taken once or twice a day over the course of about 7 days to help treat simple UTIs. Some clients are much more likely to develop UTIs, and therefore their healthcare provider may place them on what's called a prophylactic treatment to prevent UTIs, and that usually consists of either Bactrim or Macrobid that they take pretty much routinely, either every day or after certain events. We talked about in a previous lecture that females were much more likely to develop UTIs. In part of our education to our clients, we also need to tell our females that are sexually active to make sure that they are emptying their bladders after sexual intercourse, because that will help to cleanse the urinary system, and we need to make sure that we inform our clients of this to help prevent UTIs. Also, when we talked earlier, we were talking about Foley catheters and Foley catheter care. Very, very important to cleanse the catheters with just soap and water, and also to make sure that we are protecting the urinary system. We don't want their Foley catheter bag to be dangling on the floor. We want that to be raised off the floor because that could track bacteria. We want to make sure that as soon as our clients are soiled, that we do go ahead and cleanse them and perform Foley catheter care very quickly to prevent bacteria from tracking back up that catheter tube on into the bladder. Also, clients may have other types of urinary devices, one of which is a suprapubic catheter. And of course, we know the location of our bladder is directly above the symphysis pubis in the suprapubic region. And this happens, clients may have a suprapubic catheter inserted because of either trauma, or could have been cancer or some other type of obstruction within the urinary system where the ureters had to be rerouted to form the urostomy. So at first we need to know specifically what type of device we're dealing with. But we perform our standard catheter care with those clients also. We need to think about our geriatric population, because our geriatric population are highly likely to develop urinary tract infections, and they're highly susceptible to urinary tract infections. One of the classic signs and symptoms that our geriatric population usually shows up with is confusion. They usually start having some disorientation and confusion. They may have been clear within the past 24 hours, are very lucid and able to give you the time, the date, etc. And then, it's 24 hours past and they start to have some delirium and some confusion. So ultimately, that's one of the first things we start to think about in our geriatric population. We also try to determine if the client has a fever or if they are febrile. So carefully monitoring a temperature to determine whether or not it is elevated or there's a spike to facilitate a fever, or if the fever is actually present. Then we would need to start looking at those different cues and clues from our client based on their subjective complaints and the objective data that we gather to determine whether our client may be or may have a urinary tract infection. Okay, as far as the health promotion and maintenance, I also wanted to add that we recommend for our clients to take showers instead of tub baths, and for our female clients, especially little girls, we need to make sure that they are wiping from the front to the back to avoid fecal contamination. So hydration, as we talked about earlier, was very, very important. Placing your client on some type of voiding schedule, at least every 1 to 2 hours, and also making sure that their perineum area is kept very clean. It's going to be very important in promoting our health and maintenance of our clients. Okay, bubble baths are generally not good because of the fragrances and perfumes that our clients that bathe and irritate that urethra or the urinary meatus. So we want to try to tell our clients to avoid the bubble baths and the perfumes and all the soaps and different things, especially in the perineal area. All right, as we talked about a little earlier, some signs and symptoms of our UTIs could be dysuria, hematuria, a burning or stinging pain or complaint of that type of pain upon urination. And what we need to do, we've talked about the antibiotics that we would place our client on with the healthcare provider's order, but we also want to talk about some comfort measures for our client. Number one, the hydration is going to help to rinse and clean the urinary tract area, but we also want to focus on our urinary analgesics, one of which is Urogesic Blue, and it will stain the urine kind of a bluish greenish color. And the second is called Pyridium, and this medication will turn the urine an orangey color. So we need to make sure that when we're educating our clients about these types of medications that we include that they're going to discolor the urine, so that way our clients won't be frightened after they start on those medications. Okay. Clients typically start out with an urgency or frequency, as we talked about in Lecture 3, that is that sensation to have to void very frequently, and they may only be putting out very small amounts of urine and feel like their bladder is still irritated or full. Okay, that goes along with just a simple UTI. However, there's another condition called interstitial cystitis that happens usually to females, and it is from the irritation or erosion of the lining of the urinary bladder. The bladder itself has a mucinous or mucus type layer that actually protects from the acidity of the urine from actually causing ulcerations to the bladder itself. When a client develops interstitial cystitis, or what we know as IC, the client, they typically will present with some of the similar symptoms of a classic UTI, except that when the urine is checked, there may not be any bacteria in the urine. Clients will continue to have severe pain and pressure to void, and they feel like each time that they're able to go in void that provides a sense of relief for them. So actually the frequency in emptying their bladder provides the comfort for these clients. There are many different treatments that are available for clients with interstitial cystitis. One could be going to see a urologist or a specialist that will instill a solution into the bladder and do what's called a procedure called hydrodistension of the bladder. Also, there are medications available. One is Elmaron, and that medication, we have to tell our clients the medication is not going to provide frequent or very quick relief, that it's going to take several months for the clients to continue on that medication before they actually start seeing any results or any relief. So they're going to be very, very apprehensive about the medication. We, as individuals and human beings, know that we want to see some ultimate relief. If we start on a medication, then we expect that within a certain amount of time that we're going to see ultimate benefits. Well, the Elmaron medication does not provide that quick relief for the client. They may also be prescribed, a medication to, like the Urogesic Blue or the Pyridium, that's actually going to help provide that analgesic effect or that numbing sensation or decrease that painful sensation within the urinary tract. But ultimately they're going to have to be on the Pyridium, and it's going to require a lot of counseling and a lot of education and a lot of feedback from your client, and a lot of understanding on your behalf, and encouraging those clients to continue on that medication. Also, some of those clients, especially the females, are encouraged not to have intercourse while they're taking that medication, or during the process of having the interstitial cystitis, because the bladder is already so severely irritated that introduction of other bacteria or other foreign bodies into the urinary tract is going to cause a worsening of that condition. What we actually call the ulcers within the bladder, they're called Hunner's, Hunners, Hunner's ulcers, and those are classically associated with interstitial cystitis. Okay, I hope that you will join me again next time as our lecture is going to talk more about the urinary system. And remember the medications that we talked about today. We talked about the Monurol, we talked about the Elmiron, we talked about Macrodantin, and we talked about some of the specific signs and symptoms that are related to simple UTIs and also interstitial cystitis. I hope that you'll join me again next time on Think Like a Nurse.